Now we move on to our first session, which is about the impact of COVID-19 and the vulnerability in Cox's Bazaar, Bangladesh. We have with us Dr. Mainul Islam, Professor, Chairman of the Department of Population Sciences of the University of Dhaka. And talking to him today is Dr. Rabia Khatun. She works with MSF in India and Bangladesh. Welcome, Dr. Rabia, and welcome, Dr. Islam. Handing over to you now.
Thank you. Thanks for giving me the floor. So today we will talking about the COVID-19 situation in Coxs Bazaar, and with us, Dr. Mainul Islam has agreed to give his valuable time. So welcome to this meeting, Dr. Mainul, and welcome the audience also. I'm welcoming the audience from my side. So let us start the discussion. And could you hear me? Hello?
Yes, I can hear you, Dr. Rabia and Aditi. Thank you very much. Yeah.
So let me start with the first question. We all know that Bangladesh is a densely populated country, yet Bangladesh has to host almost 1 million refugees since 2017, September 2017. So in this context, the pandemic has also here in Bangladesh, like almost all over the world it is. And in this situation, we would like to ask you the context of this current situation in Bangladesh. And could you please briefly tell us about the context, the initial COVID-19 situation and how it is ongoing now in context of overall Bangladesh and especially on Cox's Bazar situation?
Well, thank you, Dr. Rabia, and also the people, those who are hearing me, greetings to everyone. So in response to the question, your first question, so the current situation at this moment, not only in Bangladesh, actually globally, we are in a very difficult situation. But you know that every day the number of infection is increasing. Currently, Bangladesh it has been ranked 24th in the world in terms of infection. Since March 8th this year, first incidents of COVID detected in Bangladesh. And later, we still now at this moment, we know that around 4.38 million identified cases until yesterday. And also 6,127 people died already due to COVID, where the rate is 1.43%. But if you think about the South Asian context, also Bangladesh is currently ranked second position. Every day the number is number of increased is globally. Not only globally, I will say that a certain period of time. Since last November, we found that that the rate is increasing at this moment. But if we think about the chronological order, since March 8 to till now, particularly if I focus on the Coxs Bazaar area, where more than 1.1 million forcefully displaced Myanmar people are living there. So in that context, we see that March since 8 March, first case identified in Bangladesh, but in terms of Rohingya or refugee or FDMN people, we found that the first case actually identified in 15th May 2020, and also 3rd June we got the last number of death at that time, first incidence of death in the refugee camp identified as official. But as I told you a few minutes ago, that still now the rate is increasing. And if you think about the host community in the Coxs Bazaar and also about the refugee camp, till now at this moment, until the 8th November, the statistics I have at this moment, we found that 4,955 host community people infected and then 342 Rohingya refugee already infected there. So in terms of the number, actually, it's quite low, but one of the reasons behind that, the number of the tests actually is quite low. And that is also number of tests is on national level, as well as also, I will say, for Rohingya refugees or FDMN people or the host community. Both level, I think the number of tests is quite low. So that's the one of the reason I can say. But at this moment, I think that if you think that how many people are died there. So in the refugee camp, we found that until now, at this moment, 10 death cases happened. But the host community is around 72 people already, in fact, already died. So in that context, I would say that the situation of the Coxs Bazaar, this is, one of the densely populated area, and the refugee or Rohingya people, where they are living there actually.
We have the host community as well. Could you please put some, the light on the host community as well? Because
so I'm going to focus on that one. So that's the densely populated territory, overcrowded. The Rohingya refugee people, those who are living there, these are very overcrowded and also unhealthy living conditions in the camps, and maintaining social distance. Actually, this is also a big challenge, and personal hygiene. These are very challenging for the refugee camp. But if you think about the host community perspectives also, because I would say that in the host community people, the number of people is refugee peoples are more higher than the host community in that place. But the thing is that the host community people, they're having a low income at this moment, limited amount of cultivable land, also poor housing facilities. This actually made the host community vulnerable, and increased also in that area, that house rent is increased, cost of transportation and daily necessary goods during this COVID situation is increased there. So if you think about that, the host community, no doubt they are vulnerable, but refugee people, they are also vulnerable. But the reason behind that, if we think making a comparison in some ways, you said poor educational level, and then also lack of awareness or insecurity among the Rohingya refugees or FDMN people, how you can say ill gossip and rumors about the isolation centers among the Rohingyas. Also fear around some kind of stigma, what I will say that in the community, and preventing seeking or receiving treatment. These are also prevailing. And one of my actually published research paper, it's a committee paper in the Lancet on 25 June. We showed there also there's some kind of fear or some kind of risk condition as belonging there, and also lack of access to water, sanitation, hygiene. These are also challenges there. And recently there is in conflict, we found that in the camps, in the various groups among the Rohingya refugee people.
So these are all ongoing challenges we have. And we have some situation about the healthcare system. So the regular healthcare system is also affected by COVID-19 situation.
Absolutely,
and
absolutely.
It is very difficult to maintain.
Right, and the primary healthcare services, particularly for medical services and continuing the care, health promotion, counseling and support, and community health, immunization program, even health education, maternal and child health. These are also provide those services is getting challenges. And I can give you one example, like for immunization services. During the COVID and lockdown time, we experienced big challenges in terms of vaccination of the vaccinated children, and the coverage was not satisfactory level. And also, during this time, we found that among the FDMN peoples, the uses of contraceptions, even for pregnancy and related cases, are also there. Or
and
even child marriage.
Thank you. And as you have said, that immunization program is also, facing problem. So how do you think? What is your opinion? Could it give a breakout of outbreak of this some infectious diseases like it happened previously, cholera outbreak, diphtheria outbreak? So is it possible also in that situation? What is your opinion regarding that?
No,
as a
definitely.
public health specialist?
No, yeah, I think, the situation, we want to improve the situation. So, for that, actually, we also think about that, what's about the health workforce, those who are working there. that we have also, if you think about the challenges, but we have to make it also consideration that limited workforce or trained medical professionals we need, and also some kind of fear also providing service those who are there. This should be removed and removed. And that UNHCR, WHO, even MSF, these are other organizations are taking steps actually during this COVID situation. But I think that integrated and proper coordinated actually actions are needed at this moment to tackle these situations.
And we all know that there is a coordination group among all these partners in under the leadership of government. They are doing it, but still there are some challenges like, as I have said, the outbreak, and there is a challenge about mental health issues also. So it is always as a issue in camp situation, but now with COVID-19, how do you see this? Is it increased, or what is your opinion?
That even in the national case, not only that case, in national scale also, we got some survey and found that there are some kind of mental problems. And globally, actually, I would say that during the COVID situation, mental situation or conditions is getting worse in different, even for developed countries too. But this should be get into a priority issue, particularly to that area. Proper counseling are needed there, and psychosocial supports are needed there. And we need to break out the trauma or fear persisting among these peoples or groups. So that is one of the important concerns in coming days. We have to think of it.
Yeah, thank you. So this is very nice from your part, so informative. And now if we go to the question answer session, we have some questions from the audience. So there is one question that some steps to manage the psychosocial stigma associated with COVID-19 among the population segments. How do you do that?
Yeah. So, that, the situation, the situation analysis, that how to deliver the message. So one of the things is the communication, behavior change communication, that I was focusing on only that information, education, and communication. And for that, actually, in the camp, if you think about the camp and outside the camp, I think that both groups are vulnerable. So, but for if we consider the camps, then actually we need to think about those who are the agents behind that, and who are the leaders, who are the community peoples there. And that, like for Maji, imams, and also other group leaders there. So sometimes, for personal level, if you think about the mental health situation at the personal level, then we need to reach the people. So we need,
and we all know that the population there is not very educated. Education level is very low. So in this context, how do you do that?
So in that question, I was saying that the role of education, counseling, and more community engagement, actually, that is very important, and need to make a trust among the volunteers and the community leaders, those who are there. And also for, as I told you earlier, before the religious leader or majis or, the people, those who are a little bit barriers sometimes, we need to take them to provide better services there. And these people have to speak about, and they have to share the information with other people. Sometimes if we don't share, sometimes have some COVID symptoms, may not be COVID, but they're kind of symptoms, but this should be discussed. And for their kind of, trust relationship, we need to produce there. And I didn't say before there, but if you have the question, then it's fine. I can address anything more.
Thank you very much for this. We have another question, like, were there any challenges regarding the, conceptualizing the international COVID-19 protocol for Coxs Bazaar scenario? What is your opinion regarding this? We are meaning that population density, hand hygiene, and all these. So you have worked there, and maybe you could tell us something about it.
Right. Thank you for this very question, because this is, I think, one of the take-home messages also from our conversations, that, we have to understand that the situation of the Cox's Bazaar is different compared to other international settings. And the contextualization of healthcare delivery models is very important for successful management. That we need to first think of. And as you know that I would say that no doubt this is one of the very crowded place, and this is one of the largest refugee camp in the world there. But think about how to will manage about the funding situation. So even joint response plan, I found that around 35.7% unmet requirement for non-COVID funding to run the coordination of humanitarian activities there. And particularly for the COVID situation, 68% of the fund are unmet still now at this moment. So limited financial aid, this is one of the things, but no doubt that through the international protocol, we have the WHO guideline we have to follow because in that territory. But one of the important messages I would like to mention that now Bangladesh, as well also globally, we are in the second wave of increasing COVID.
Yes, that is another important.
So as long as I would say that the situation is not getting worse, so we need to think about that we have to control the mechanism, and at this moment we have to take action so that second wave of increasing COVID cannot go further. So from public health perspectives, I would say that we need more rapid test, contact tracing, isolation, and quarantine. These actually followed by WHO guideline, and tests in process should be more user-friendly.
I think it is very clear now. So we have another question overall in context of overall Bangladesh. The question is how COVID situation is there in rural Bangladesh, and is enough testing is available? Could you tell something about this?
Definitely. I think that in terms of the number of population, you know that the number of testing center, if you think that these are not available, all districts in all divisions level, still we are far behind. So that is one of the more concern. And as I told you that if you follow the international protocol or the WHO guideline, you need test, and then isolation, and then quarantine, and this should be ensured at the rural level.
Thank you. As we are talking about the international guideline, we need to talk about the international organization like WHO and MSF. What could be their role? How they could play a role regarding this, especially MSF in these refugee settlements to support the government authorities. What is your opinion regarding this? How do MSF support the government authorities? That's the question.
Well, MSF is an international organization. Those who are working there, actually, they have to make a trust with the government, So first needs to make integration among these governments, course of action.
MSF is working with the government permission, that is fine. But how do they support the government authorities? That is the question.
Yeah, they can do in a different way. So supports like, what kind of supports we are thinking? Some supports may come out from the training or technical support. Some supports come from funding support. Some supports may come from, like for WHO and for vaccine and other issues. So supports are different levels, but for MSF, as they are at the grassroots level, those who are working there, so they need to make a community bondage among them. And also for the people, those who are there, they need more community workers, actually, more people, the recruitment of more professionals.
Thank you. And we all know that MSF already has facilities, about 9 facilities in that area, in camp area, and they are providing services. Treatment protocols are there. MSF has its own workforce who are working along with government. So that those are the issues that how MSF is supporting. Those are also. Yeah, thank you. So there is another question like, how can we integrate humanitarian development and health sectors for response to pandemic?
Yeah.
If you could tell us something about it.
Yeah, I think COVID has given a good message to everyone that whatever we are doing, we think you have to positively that more focusing on health issues, because earlier actually health issues was not well addressed, and in terms of South Asia, even for Bangladesh also, we found that this is not a priority area of focus. So at this moment, I think for humanitarian people, those who are also talking about earlier displaced population or the way we are talking about that, but at this moment, this is a critical time at this moment, and this is I think the leadership, the people, those who belongs to the policy level, I think they have to make an consensus that, well, we need to focus on priority on health, humanitarian, and all development. Development doesn't mean only economic development or GDP growth and empowerment. Development means also well-being of the population, and well-being definitely belongs to the humanitarian of the peoples. Without considering them into inclusion in the development process, ultimately the meaning of development is not really the fulfilled. So in that context, I think that we need good coordination. Yeah.
Yeah.
And also another one thing I would say
something about, you know, your.
Yeah, please.
Okay. Continue.
Well, so another one thing I was planning to say like that, you know, that at this moment as an academia, I belong to the academia and doing research there. I think one of the post-COVID impact on the survivors are very much needed, because, you know, the people, those who are already infected there. So if you want to make them as a productive labor force or productive human being, then definitely, you know, there are different kinds of effects are going on there. So we need more research on those people, that how they can overcome. It's not only for mental health, it's one aspect, but there are other issues where we need to focus them to make them as a productive labor force or human being actually. So there are potential lot of scopes actually to do more research. So I would suggest that policymakers, even for international community, we have to think about the post-COVID survivors. We need to more multi-level or multiple ways of engagement for doing action-based research, as well as also for the policy level guideline to introduce. Because the COVID this is the one issue, but maybe another pandemic we may experience. So in that context, you know, we have also need to be prepared in that way.
Thank you. So thank you so much. And considering that your last message, that we would go through this pandemic, and then we will be able to face the post-pandemic situation as well. And we have to work hand to hand with other partners, along with government, of course, because government is leading the whole work in context of Rohingya refugee. And let us hope for the best. Thank you so much for your valuable time, and I hope the session was enjoyable to our audience as well. Thank you.
Yeah, thank you very much. And I wish the great success of MSF Scientific Days Asia 2020. And thank you very much for incorporating with me. Thank you.
Thank you, Dr. Islam. This was an extremely interesting conversation, and how it's very important. And there are so many issues which the general population is not even aware of, how the pandemic has made so many populations and so many vulnerable people even more susceptible to this virus. Thank you so much. Thank you for being a part of this conversation.